Hi, everybody. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I'm so excited to be with you during the start of National Minority Health Month as we prepare to mark Black Maternal Health Week, starting in just a few days. I'd like to begin by thanking Rick Pollack and all of the American Hospital Association's leaders and members for your work to advance the national conversation about maternal health in the United States. Black Maternal Health Week is an important reminder of the urgent need for bold action to address our nation's maternal mortality crisis, which disproportionately impacts Black women and birthing people of color. It's also a reminder of how much change we've achieved since the first Black Maternal Health Week 3 years ago, from increased attention on the issue to legislative successes. But even with this progress, we know there's so much more work to do. It's unacceptable that the United States, the wealthiest country on earth, has the highest maternal mortality rate in the developed world. And for African American mothers, the risks are even greater. Black moms are 3 to 4 times more likely to die from pregnancy-related causes than white moms. And for me and so many others, there are painful stories behind these alarming statistics. Stories like Shalon's. Dr. Shalon Irving was a classmate of mine in graduate school who went on to become a dual PhD, CDC epidemiologist, and lieutenant commander in the U.S. Public Health Service Commission Corps. She was also an avid traveler, talented photographer, gifted chef, and an accomplished author. Yet Shalon's PhDs, comfortable salary, and family support were not enough to protect her from the glaring inequities Black women face when giving birth. Shalon died of complications from high blood pressure just 3 weeks after she gave birth to her daughter, Soleil. Shalon's memory inspired me to co-found the Black Maternal Health Caucus in April 2019 with Congresswoman Alma Adams. In the 2 years since, our caucus has grown to more than 100 bipartisan members of Congress, all committed to saving moms' lives and ending racial and ethnic disparities and outcomes. Our caucus achieved an important legislative success in the American Rescue Plan, which included a policy to give states the option to extend postpartum Medicaid coverage from 60 days to 1 year after the end of a pregnancy, ensuring moms have access to care for the full postpartum period. Extending postpartum Medicaid coverage is the single best thing we can do to save moms' lives, and I'm so grateful for your association's dedication to this cause. We've even more work ahead to ensure that a year-long postpartum Medicaid coverage is a permanent reality for every mom in every state. But coverage alone will not end this crisis, and as Shalon's story shows, and others that you might have heard of from Serena Williams to Beyonce. And so to address the root causes of maternal mortality, morbidity, and disparities in the United States, we need to take bold action to advance data-driven, evidence-based policies that center the voices of families impacted by this crisis. And that's why, in February, I introduced the Black Maternal Health Momnibus Act with Senator Cory Booker, Congresswoman Alma Adams, and now more than 130 House and Senate co-sponsors. The Momnibus is a suite of 12 bills that include bipartisan policies to eliminate preventable maternal mortality, end racial and ethnic disparities and outcomes, and promote true equity and justice for all. The bills in the Momnibus address both clinical and non-clinical factors that influence maternal health outcomes. All throughout the legislative package, we included investments in local organizations leading critical initiatives in their communities, including grant programs focused on addressing disparities for Black moms and other women and birthing people of color, providing treatments and supports to pregnant people and new moms suffering from mental health conditions and substance use disorders, providing resources to moms in communities that have been impacted by climate change-related risks like extreme heat and air pollution, growing and diversifying the perinatal workforce, and addressing social determinants of health like housing, transportation, and nutrition. By providing desperately needed funding to organizations that are caring for vulnerable moms in communities across the country, we can save lives and support families. I look forward to working with the American Hospital Association, as well as my Democratic and Republican colleagues in the House and Senate, and the Biden-Harris administration to get this legislation signed into law. because every Black mother and birthing person deserves access to the care and support that they need during pregnancy, throughout labor and delivery, and for the full year-long postpartum period and beyond. So thank you for your commitment to addressing these important issues, and thank you again for the opportunity to be with you today. I look forward to the day that we're back together again in person, but until then, take good care of yourselves, everybody.